Learning English with English faculties.
Hey there! If you are a healthcare professional looking to take your career to the global stage, you are in exactly the right place. Maybe you're a nurse dreaming of London, or a doctor aiming for a fresh start in Sydney. Well, today, we're going through a comprehensive, warm, and encouraging guide to the Occupational English Test, or as it's commonly known, the OET. In this explainer, we're going to explore everything you need to know to confidently prepare and completely ace this crucial exam. Let me ask you something. Why take a general English test when you're already a medical expert? Seriously, think about it. You've spent years mastering complex medical terminology, patient care, and clinical communication. So why on earth would you sit for an exam that asks you to write history essays or make small talk about penguins? The OET is entirely different. Your existing medical knowledge is actually a massive advantage here because this test speaks your professional language. You aren't starting from scratch. You're just translating your current expertise into English. Okay, let's jump right in. We're going to cover exactly what the OET is and the amazing places it can take you. Then we'll walk through the simple steps of booking your test before diving into some absolutely crucial study tips for all 4 sections of the exam. Finally, we'll talk about how this all sets you up for a fantastic global career. So let's start with a proper welcome to the OET and what makes it so special. I really want to emphasize right away that this test is built specifically for healthcare heroes just like you. It's not some generic language exam. The OET is an international English language test designed to specifically assess the communication skills of 12 distinct healthcare professions. So whether you're a nurse, a doctor, a dentist, or a physiotherapist, this test is tailored perfectly to your specific daily profession. The clinical scenarios you encounter in the test are the exact same ones you handle in your clinic or hospital every single day. Just think about the difference between the two for a second. General English tests might ask you to debate globalization or analyze abstract academic texts, but the OET, it focuses on patient consultations, referral letters, and realistic clinical scenarios. It uses real healthcare vocabulary. You already do this incredible work daily. The OET simply tests your ability to do it effectively in English. So honestly, you can let out a huge sigh of relief right now. You already know the subject matter inside and out. Now, where exactly can this test take you? Let's talk about the exciting part. Passing this test unlocks some incredibly exciting destinations for your future. If you're aiming to register and work in an English-speaking environment, the OET is widely trusted. It's fully recognized by healthcare regulators, educational institutions, and immigration services in major destinations. We're talking the US, the UK, Ireland, Australia, New Zealand, Dubai, and Singapore. Imagine the opportunities. One profession-focused result supports your registration in all these amazing places. It makes the study effort absolutely worth it. Okay, let's talk logistics for a second. Getting signed up is easier than you might think. Taking the next step to actually register is a super simple process. First, just visit the official website at occupationalenglishtest.org. Second, use their tools to find a convenient test venue near you. They offer frequent test dates and even computer-based options depending on where you live. Third, always check the official test fees directly on their site. That's for sure the safest and most up-to-date route. And finally, book your test dates. Taking care of the logistics early gives you total peace of mind, allowing you to focus purely on studying. All right, let's get into the actual test strategies, starting with your receptive skills, listening and reading. And a warm reminder here, you already possess the medical knowledge necessary for this. Let's look at the listening subtest first. It's a 40-minute assessment featuring realistic patient consultations, handovers, and healthcare interviews. You are not going to be listening to some dry university lecture on economics. You'll hear everyday patient language, which you will then map directly to your professional medical knowledge. It's all about catching practical details in real time. Now, here's a really interesting strategy. For the listening test, use your reading time to predict answers before the audio even starts. Ask yourself, am I listening for a dosage, a symptom, or a timeline? Second, listen carefully for synonyms, not exact words. Patients use everyday language, while the test notes use medical terms. So if a patient says they have an awful headache, the notes might say severe. That's the connection you need to make. Finally, pay close attention to the context sentences to help navigate the multiple choice questions. Training your ear to connect colloquial, everyday phrases to clinical terms is everything here. Next up is the reading subtest. You have 60 minutes in total. Part A is a 15-minute gap fill task that requires super fast skimming and scanning. Then, parts B and C give you 45 minutes to evaluate a deeper understanding of workplace policies and complex medical articles. My absolute top tip for you here: always read the questions first before reading the text. Why? Because it acts as a filter for your brain. It saves you incredible amounts of time by telling you exactly what data to hunt for. You stop reading like a novelist and you start reading like a detective. Moving right along, let's talk about how you express yourself, the writing and speaking sections. This is where you get to demonstrate your excellent bedside manner. For the writing subtest, you get a 45-minute task requiring you to write a profession-specific letter, like an urgent referral or a discharge letter, based on a set of case notes. And hey, don't worry, they aren't grading your famously bad doctor handwriting, just your English. Remember, you get 5 minutes at the very beginning just to read the case notes. You cannot write during this time. Use it wisely to understand the patient's situation, synthesize the timeline, and figure out exactly who you are writing to. I want you to remember this piece of advice from an expert OET teacher. Don't just copy the case notes, select what the reader needs. Seriously, one of the biggest mistakes candidates make is writing an incomplete note form or including completely irrelevant information. If a patient is being referred to a specialist for a broken leg, the specialist probably doesn't need to know they had a mild cold 6 years ago, right? You must transform those notes into full grammatical sentences. Summarizing effectively and showing you know what your specific reader needs is exactly how you achieve a high score. Finally, we have the speaking subtest. This is a 20-minute test consisting of a warm-up and 2 role plays where the examiner acts as a patient or a caregiver. I really want to demystify this for you. It is just a conversation. If you don't know the exact medical diagnosis for the role play, it doesn't matter. It's an assessment of your clinical English communication, not your medical textbook knowledge. The role play is designed so that specific clinical knowledge won't advantage or disadvantage you at all. It's purely about how you interact, reassure, and explain. So here are some highly practical role-play tips to make sure you shine. First, greet the patient warmly to build immediate rapport. Second, rephrase complex medical ideas into simple terms. Don't overwhelm them with medical jargon. Third, regularly check if the patient understands you by asking things like, "Does that make sense to you so far?" And lastly, use strong empathy phrases like, "I understand this is difficult for you." Active listening, empathy, and clarity, that's what the assessors are scoring you on. Speak to them just as kindly as you would to a patient in your own clinic. Let's bring it all together and talk about the ultimate reward, your global healthcare career. This is the payoff for all your dedicated preparation. The OET isn't just an exam you have to pass, it actively builds job-ready communication. By studying for this test, you're actually sharpening your real-world clinical English. You're learning how to write clearer referral letters, interpret patient histories more accurately, and communicate more empathetically. It ensures you can safely and confidently practice your profession anywhere in the world, literally making you a better, more effective healthcare provider. So, I want to leave you with this final, empowering question. Where will your medical career take you next? With the right preparation, a positive mindset, and a focus on your existing clinical communication skills, you have absolutely everything you need to succeed. The world needs your expertise, and this test, it's just the key to unlocking the door. Thank you so much for joining me on this explainer, and the absolute best of luck to you on your exciting OET journey. You've got this.